recording process. So good morning, everyone. My name is Christina Tony Schmidt. I am here with Forge Survivorship Center, and I'm so excited. We're here this morning talking with Miss Beth Chandler on lymphedema and breast cancer. And so I'm going to go ahead and turn it over to Beth and ask her to introduce herself and to share a little bit about herself.
My name is Beth Chandler. I am from Birmingham. I'm a physical therapist and have been practicing physical therapy for 29 years. I'm also a certified lymphedema therapist, and I got certified in 2019 in the fall. And I started the lymphedema program at Grandview Medical Center during 2020, during the pandemic. We were closed for a little while in our outpatient clinic. And then since May of this year, I've been treating 100% lymphedema patients. I'm from the Birmingham area. I'm married this 20 years, almost 21 years, and live here in Birmingham.
Awesome. Thank you so much, Beth. Can you share with us just a little bit more generally about what is lymphedema? How does someone get lymphedema or get diagnosed with it?
Lymphedema is swelling that occurs because of a dysfunction in the lymphatic system. There's lymph vessels all out in our extremities and in our skin. And when an excess of lymph fluid builds up in those vessels, because of a dysfunction in the lymphatic system, then we get swelling, usually in an arm or a leg, but you can have swelling in other parts of the body, such as head and neck, and even in the truncal areas. As far as how you get lymphedema, there are risk factors. Now, you can be born with lymphedema, just called primary lymphedema. The majority of lymphedema patients that we treat are more of a secondary lymphedema, which occurs with our breast cancer patients. It occurs because of surgery where lymph nodes have been removed. Also, another risk factor is radiation, because it can also damage lymphatics. If you've had lymph nodes removed and radiation, your chances of developing lymphedema increase. There are other causes of lymphedema that I treat people with, such as vascular problems, vein and circulatory problems. Worldwide, there's a condition, it's actually an infection called filariasis, and that's the #1 worldwide reason or cause of lymphedema. It is not, it's a mosquito-borne parasite, and it's not in the US, but in developed countries, we see a lot of patients with lymphedema. And other things such as blood clots, trauma, obesity, those are also risk factors for lymphedema. And if you have any of those things in addition to your cancer surgery, then again, your risk increases.
Yeah. Oh, thank you so much for sharing that. And is it, I know you mentioned that there's certain reasons people may get lymphedema, particularly if they're diagnosed with breast cancer, but does everyone with breast cancer end up developing lymphedema to some extent?
No, if you've had lymph nodes removed, like if you've had one, a sentinel node biopsy, 4 to 6, the more lymph nodes you have removed, the higher your risk is for developing. Not everyone develops lymphedema that have had lymph nodes removed. They really don't know why. Some develop and some don't. From what I see in my practice, if patients have had lymph nodes removed and they've had radiation therapy and possibly are overweight or have other risk factors that might, like vein and vessel circulatory problems, then the more risk factors you have, the higher frequency it is that you might develop lymphedema.
Yeah. Yeah, those are all important things to know to look out for. And so, of course, if you're going through breast cancer, if you're diagnosed with breast cancer and you have your lymph nodes removed, is there any way to prevent lymphedema after surgery?
Yes, and you can't always prevent it, but it's good to know how to do everything you can to prevent lymphedema. Knowing what the risk factors are is one of the #1 things, so that you know if you're at risk. Maintaining a good healthy weight is another reason that can help prevent lymphedema. Also, avoiding injury to the arm, such as dog bites, cat bites, needle sticks. Most patients are told not to have a needle stick in that arm, not to have blood pressure. cuffs on the arm,
Mm.
and anything that might cause an injury, even burns like cooking injuries, gardening injuries, things of that nature, trauma to the arm. And I'm saying arm because of the Breast Cancer Association, but I do have some patients that this would apply to their leg. Avoiding things that would cause injury to the arm can also help you prevent the onset of lymphedema.
Yeah. Is knowing that there are some preventative things that even if you do them, you may still end up having lymphedema. Is lymphedema curable?
The short answer is no, it's not curable. It is a chronic condition, but if it's treated early and identified in what we call the reversible stage, then it can be managed and preventing the increase of the swelling, and it can even cause skin changes. The main thing is to get treatment early so that you can get education on your specific type of or involvement of the lymphedema and understand how to manage it at home, because it can be treated and managed at home if directed by a lymphedema therapist.
Yeah, absolutely. Well, as you are a lymphedema therapist, can you tell us what kind of a general treatment looks like for someone if they had breast cancer, had lymph nodes removed, find themselves with lymphedema? What does kind of their therapy process look like so they can manage it at home?
Sure. Yes. Once you're evaluated by a therapist, most of us are trained in what's called CDT, complete decongestive therapy. And that involves several modalities. It involves taking care of your skin and nails, because knowing, to prevent infection and prevent injury to the skin. Also, there's a manual technique called manual lymphatic drainage or manual lymph drainage. You'll see MLD, which is what that stands for. It's a manual technique that the therapist performs on patients with lymphedema to help facilitate lymph flow and help redirect lymph flow around the area, such as if you had your lymph nodes removed under your arm, you can route that lymph flow from the arm to other areas of the body to help eliminate the excess fluid. Also, performing simple exercises that can help with the muscle pump action to help pump the fluid out of the body. And compression. You see people with compression sleeves, compression gloves. Also, the CLTs, the lymphedema therapists, do compression bandaging and can teach family how to do compression bandaging to help reduce the swelling. Then once it's reduced, getting fitted for a compression garment. Even in the early stages, we do sometimes recommend a compression garment for prevention. If you're at a high risk, you can get fitted for a garment early when you're not in a swollen state, so that we can help prevent additional swelling. And then after that, it's education, self-care, and understanding how to take care of yourself at home.
Yeah, absolutely. Yeah. So what advice would you give to someone then who recently had their lymph nodes taken out and they're nervous about potentially experiencing lymphedema?
Yes, well, understanding what lymphedema is and how to prevent it. Also understanding what your personal risk factors are. If you've had, say, a radical mastectomy with, your lymph nodes and axillary node dissection, and you're going to go through radiation, it's good to ask your oncologist about getting a referral, even if it's early on. Most of the oncologists or radiation oncologists are very eager to get you in with a therapist, so that we can get an assessment early, teach preventative strategies, as well as getting baseline measurements and possibly a prevention compression garment.
Absolutely. And where would someone find, so this is a little off of our script, but where would someone, if they feel like they're going to experience it, if they're nervous about it, how do they get that reference? Do they talk to you said they talk to their oncologist?
Yes, or their physician. It can be your primary physician. Most of the lymphedema therapists, at least in Alabama, we have to work under a physician referral. So their oncologist, their radiation oncologist, even their primary physician can basically, it's like writing a prescription for a medication, except a lot of times they can send us a fax or a written referral. I mean, a tele, referral. And then the therapy clinic will call and schedule you a visit. And there are lymphedema therapists that are occupational therapists and physical therapists. We all treat lymphedema. We're all trained the same way and can treat lymphedema. And also we can evaluate for other needs you might have. If you've had surgery for breast cancer and are having shoulder problems, neck problems, if you're tight in your musculature, there's other things in addition to lymphedema that a therapist can help with.
That's awesome. I'm going to ask you another question that's a little off our script, but only because we
Sure.
were talking about it before others got on the call. I was wondering, could you share a little bit about the history of discovering lymphedema? You had kind of mentioned that might have started actually in Europe, and medication is still really new and all of that stuff. So could you share just a little bit about that history and how treatment is evolving?
Sure. Like I said, I've been practicing 29 years. And when I went to, it was actually a master's program at UAB at the time. It's now a doctorate. But there wasn't a lot known about the lymphatic system. And the development of the CDT, the complete decongestive therapy, even the manual lymph drainage techniques were developed in European countries. There are even people go and get a manual lymphatic drainage session, like we go get massage, because it is relaxing. It helps with, this touches a little bit on my special stories, but it does help with pain control and getting rid of inflammation throughout the body. Even without lymphedema, we all have swelling in our tissues, and the manual lymph drainage can help get rid of that swelling that's out in the interstitial tissues. We all hear about inflammatory foods and things, but the manual lymph drainage is wonderful at getting rid of excess fluid. And it was brought over to the US, and we know a lot more about lymphedema now. And they also have even some special imaging. I'm not even sure if anybody in Birmingham does this, but lymphoscintigraphy, where they can actually send dye through the lymphatic vessels to identify. And it's really the only way they can, it's maybe called a lymphogram, that they can actually diagnose primary lymphedema, because it has to be documented that there is somewhere in the body a lymphatic abnormality. And that's very new technology that we haven't had around. The treatments, and another treatment that I didn't mention earlier, because it's sort of outside the CDT, the complete decongestive therapy realm, is a compression pump. That's been around for a while, and the compression pumps have evolved to more mimic the manual lymph drainage techniques, and are an adjunct to traditional therapies. But they've also, the science of those have really improved their ability to control lymphedema.
Oh, wow. It's so exciting to hear how, I mean, you've been practicing for so long, things have changed so much, and hopefully treatments and diagnosis and things like that will only continue to improve with technology. So thank you for indulging me.
Yes, oh, sure. The training that I went through to become a lymphedema therapist was very extensive. And it was like going back to school. And everything I learned, I did not learn in school. So it's definitely a specialized area. I think most physicians would tell you they also are not schooled in this extent of knowing what lymphedema is and how it's treated. At least the physicians that I've talked to that send me referrals are, the cancer doctors, the oncologists, radiation oncologists, and surgeons know more than your average, than your other types of physicians about lymphedema, because of the nature of the lymph nodes, and the lymphatic system is part of the immune system, which is so involved with cancer and cancer treatments.
Yeah. Well, I'm grateful then there are therapists like you that we
Um,
that prevent their
There
primary.
is a need. There is a shortage of therapists. We definitely need more therapists in and around. Most cities would tell you they need more therapists.
Yeah, absolutely. Well, can you share any meaningful stories with us about some patients that have come to you with lymphedema and how you treated them?
Yes, I would say special benefits that I found of some of the therapies, specifically the manual lymph drainage and even the compression really help with pain control more than I ever thought. And even can help with pain control in other areas of the body because a lot of painful things in our bodies are really because of inflammation in the area, like back pain, even some headaches and neck pain and things often are a result of swelling. I've also treated patients with other disease processes such as lupus, gout, just, and collecting their history that have gotten relief from some of the swelling and pain that they have with the manual lymph drainage. Even when I'm treating someone for breast cancer and working more on the swelling in their arm, it also helps again with swelling in other parts of the body. And so that help with pain control has been really a wonderful side effect of some of the treatments that we do. Also, specifically to breast cancer, it's been really neat for me to be a part of that community. I'm not a breast cancer survivor. I was touched by breast cancer because my mom is a breast cancer survivor.
Mhm.
She fortunately is a low risk for lymphedema, but it's been really great for me to follow along some of the patients that I've seen during their radiation. The radiation oncologist, and we have a wonderful oncology group at Grandview that have been sending me patients as soon as they started radiation. And I didn't realize how helpful that was going to be for them. Number one, just to kind of have that support of another professional person looking at them to make sure as they have skin changes that they're not losing range of motion in their shoulders or their neck. Some of the positioning that you all have had to get in to do radiation on a daily basis for 6 weeks can be taxing on the body. And that's been a really neat thing for me to see and be a part of that person's journey through radiation and be able to pick up on and help prevent tightness and things that are a little bit outside the box of the lymphedema, but are in my scope of practice as a physical therapist.
Yeah, absolutely. That just seems like such an incredible team that is around you, like anyone who's experiencing radiation alongside navigating lymphedema. It's exciting to have so many well thought out team members like that. So thank you for sharing that.
Yes.
Um, as we're kind of wrapping up, I want to know, is there anything else you'd like to share with our listeners or future listeners, people who would find this video and maybe they're been diagnosed with lymphedema? What are some final thoughts you would like to share?
Mostly to understand what your personal risk factors are, understanding the signs and symptoms of lymphedema, which can be as subtle as you can't get your rings on one morning. That's one of the first things that I tell my patients, to be sure to take your jewelry off at night, put it back on in the morning. Any little small thing like that you can notice, because lymphedema, it doesn't start out as being painful. It can get painful if you're developing skin changes, but lymphedema is not painful. So your arm's not going to start hurting all of a sudden. You may have pain because of the surgery you had, but you're not going to have pain with lymphedema, especially the early stages.
Mhm.
Also, some other signs and symptoms to watch for are a feeling of heaviness in the arm, or like you're having difficulty performing tasks with your hands that you weren't able to, like buttons and zippers, small task writing. Your fingers feel kind of funny when you're holding a pen. So little small changes like that in your arm. Be sure to ask your physician to get a referral to a lymphedema therapist so that you can And even if you're not experiencing signs and symptoms, but you know you have a couple of risk factors, to go ahead and ask for referral. As a therapist, I'm not going to use a lot of your therapy visits because we know those are limited during the year, but to just start, get a baseline assessment with a therapist, get the education you need, and then have a contact, because they'll always have your measurements once you've been measured. And if you feel like you're having a flare up 6 months later, 8 months later after radiation, then you can always get back in with that person to seek treatment at that time.
Thank you so much just for sharing all of your knowledge and your expertise with us. And I'm excited that this video will be used for a resource for others who may be encountering lymphedema in the future. But for now, I'm going to stop our recording and take us into a time of conversation. So thank you so much for sharing.
Thank you for all of you for joining today.